Welcome to Typical Angry and Black, where we're not really angry, we're just passionate about what we're speaking about for our community. Today's episode is going to be about mental health, how it is affecting not only our community, but us individually and in our everyday lives and how we manage through every day. Of course, I have my normal panel, but I have two additional guests. I have Katina and I have Chelsea. Thank you guys for joining us today on talking about mental health.
Thank you.
Thank you.
Thank you.
For me in the Black community, it's not really talked about mental health. We talk about crazy, we talk about insane, because we're quick to say, oh, they just crazy, or they just talking out the side of their neck, or if somebody telling you I'm having a mental breakdown and I'm feeling lonely, oh, go pray about it. They don't say they're gonna pray with you, but go pray about it. How do you guys think that mental health has affected you individually? And then because I know we have a lot of people, so I'm gonna start with Chelsea. How do you feel like mental health has affected you personally, Chelsea?
I think mental health has affected me personally by making it difficult to identify and understand because it wasn't taught or expressed or treated with family and friends around me. So it's affected me personally because if and when I know something doesn't feel right, instead of thinking, oh, maybe I should get help, it's more or less that maybe something's wrong with me. And that's how it's really affected me in my outlook.
What about you, Ms. Adam?
Mental health has affected me by keeping things. I'm a type of a person, I keep stuff to myself. I keep a lot bottled up inside of me. And with that being said, keeping it bottled up, that anger or that hostility or that it makes me more depressed and I'm thinking more about, okay, woe is me, or I'm not really trying to get out of that bubble, so to speak. But as far as the mental health, you need to talk about it. You need to talk to someone. I was always in denial. I can get through this. You keep telling yourself that. But if you need help, it never hurts to tell someone or let somebody in or let them know what you're going through, because that's going to make the difference in your recovery or how you deal with this.
Yeah. What about you, Mel?
Well, mental health, we could talk about this all day, but mental health is, it's an important topic nowadays, which back in the day wasn't that important because people didn't feel like, we as a Black and Brown community needed services for mental, health situations. I know I have people in my family that we would just say, oh, they crazy. Don't pay them no attention. When there was really something going on, some underlying, issues that they had that they never sought help for. And I know that we could talk about, health services too, because back in the day, it wasn't catered to people like us who needed it. If we went to the doctor and told the doctor we were having these issues, we didn't get the same treatment as, our counterparts, in this country. So it left a lot of underlying issues, left unresolved. So now that we come to, I say my generation, we openly talk about it now, but just a few years ago, we did not. So a lot of things that we went through, and I could say personal experiences in my life broke me down to a point when I was a teenager, I wanted to take my own life. That's a mental health issue. At that time, I had nobody to talk to, had nobody to go to. There was nobody to help me get out of that situation. Now, you said something about, people tell you to pray. Yeah, I was told to pray, but pray how? Pray for what? Where'd I go? What I
pray for me? Pray with me.
Yeah, exactly. But I tell you, because I did not die, God allowed me to see another day, even though I didn't want to. At that point, it was a mission for me now to figure out what was wrong with me and try to take care of myself at that point. You know, so now I recognize the signs. I recognize things that happen in my life that's going to break me down mentally, and I know how to get the help that I need for it.
What about you, Katina?
Well, mental health has affected me from the past where I hold, I guess, like my parents or whatever, accountable for not ever bringing it up. It was never discussed. You just, as you stated, looked at someone and stated, oh, they're crazy, or oh, ignore them, or oh, it was just always shunned away. As to now, my children, each one of them, I have 4, all suffer with one type of illness or another, and I'm able to actually look more toward how to help them, make them more aware, make people around me more aware, not shun them, because I don't want them to shun anyone. So I'm more open to the learning aspect of it. But again, still, my parents, they're still like, I'm in the wrong. I shouldn't blatantly put my children's business out there, you know? So it's a stressful situation, because no matter what your age is, you want to be respectful and obedient to your parents. However, they don't view it, mental health, like per se, my people that I'm around. So it's kind of like, what do I do? Because now my mental is being affected, because I'm trying to help my children for the betterment and help people around them, and the children. Oh my God, the children I'm trying to at their schools are impacted. You see all the shootings. The kids are crying out and no one is paying them any attention. So it's affecting me directly, even putting me in a current situation now.
What about you, Philip?
For me, it's I mean, I watched what it's done to people. Mental, not being able to talk to somebody, seeing people break down, and you know, just how to deal with certain things. When I was younger, I always tried to deal with things on my own. You know, thoughts, feelings about certain things, and you know, stuff like that. I think one of the things that helped me along the way is just recognizing the truth in every situation and not making excuses for other people or for, you know, situations, just, you know, owning up to it, or having to, you know, just realizing, you know, if it involves another person, just realizing this person is who this person is. Like I said, I've seen it affect other people, like when, you know, they don't have, you know, nobody to talk to and all that built up inside. And then when it comes out, you know, the negative way. And then everybody's like, oh my God, what's wrong? When, you know, this person been asking for help for the longest, and nobody, you know, people tell you to pray, but the thing about praying, you know, you got to act on it. You know, I can tell you to pray all day, but let me show you how to get out of your situation. Let me tell you what worked for me. You know, it may not work for you, but just some ideas and some suggestions, you know. And I learned, you know, by talking to people, you know, that helps, you know, just hearing, you know, for other people, knowing that they're not the only ones that went through this or going through this, and, you know, hearing ideas and suggestions from others, you know, that helps a lot.
I know for me, I wasn't diagnosed until I was in my 20s with being bipolar, ADD, and clinically depressed. And I used to want to say that I was depressed because of my mom, or, you know, bipolar just up and happened. And I was in denial for such a long time. And it took for me to, I feel like the closer I've been getting to God, the more I've had realizations in myself that maybe these people wasn't lying about how I am, and maybe it's true. Like even before my mom died, I had such anger issues, and I could not understand where the anger was coming from. And it was so displaced and so unorganized. And I would have manic episodes with the anger and not realizing I'm having manic episodes. And I'm a child because I'm confused. What's going on with me? What's wrong with me? And then I have an uncle that lives in the basement, and sometimes he's not there. You know, he got his own place. Then he come back, and he was paranoid schizophrenic. The neighborhood called him Crazy Cliff. That's how well known he was at being crazy. I did not want to be labeled like my uncle. So, you know, me trying to figure out like, what's wrong with me, and then here goes trauma. My mom dies. So it's like, man, something else triggering. And I didn't, again, displaced anger, didn't understand, you know, and I came off like a problem. And it wasn't until I became an adult and I started seeking help. I would pray and I would tell my family I feel lonely in my heart. I'd be like, oh, I feel so lonely in my heart, you know, and don't nobody understand how lonely I feel. And I can't explain it. And they would say, well, just pray on it. Your faith in God must be weak. I'm like, but I talk to him all day, every day. They will constantly say, pray on it, but nobody will ever pray with me or tell me what I need to ask for or how to move in the work part of having faith. So it was just like all over the place. And now that I'm an adult and I see little signs in my son, I know how to deal with it now because I'm starting to get the help that I wish I would have got as a child. And I feel like in our community, as children, when we're crying for help, because it is unknown and it's a mystery, our people don't know how to help. So they feel lost. And then I think as parents, when our children say something is wrong, we think we did something wrong as parents. And, you know, I know a few of us on here as parents, I don't know if you agree or disagree that if your child came to you and told you, I feel lonely in my heart, something is going wrong, you know, I have these episodes. Do you feel as a parent that is a reflection on you?
I mean, it's not, or, you know, it possibly could be. Because sometimes it's the way that we live our lives too as parents that can cause stress and mental anguish to our children. So I don't know. My only thing would be, how can I help you with this? You know, what do I go? Who do I seek? You know, what advice do I get? What specialist, what doctor, whoever it is, you know, to take you to get these problems resolved. Because the thing is, when we have those issues when we're young, they tend to fester and get bigger as adults. You know, we can't function, we can't live our lives, right? So that's why right now in this world, we have so many people with so many mental illnesses that have not been treated or not have been, actually, they haven't even been told that they have a mental illness and they think that they're fine, but they're out here going crazy. You know, as saying, hit the air quotes, you know, they're shooting up people, they're hurting people, they're hurting themselves, right? But they have problems that no one has ever sought help for them to get those things resolved. So I think, you know, I see now that we talk about it, we have mental health month and all this other stuff. And, you know, I'm so proud that we do, but it's more that we have to do for our individual community too. So it's like, where do we start? What do we do? Maybe by talking about this, you know, that's definitely a start. Talking to people in our families, you know, talking to each other. How are you doing today? Not just how are you doing? No, how are you doing mentally? What's going on in your mind today? You know, are you feeling like you want to hurt yourself, or are you good? Right? Are you feeling like you're just in the dark? Some people feel like I'm in a room with a bunch of people, but it's all dark. You know, we need to be talking to each other. We need to be listening to each other more.
Yeah.
We need to help.
It's hard to actually help when when it's like an embarrassment. I have a lot of people that when you do ask them, you know, hey, how you doing? I'm fine, but you can tell something is wrong. And then if you try to like go a little deeper with it, they're like, you in my business. They're more negative too. They don't want to open up. And then now, guess what? You have a problem with your friend or your neighbor because you're really trying to look out for them and really have good intent, but they're so down in the dumps or looking at you like you got it all together, nothing's wrong with you, your life is great, and I'm over here miserable, you really don't care about me. It's kind of a catch-22.
It is. And I
don't think of it as
oh, wait, I'm sorry. Go ahead.
I don't think of it like, I hear what you're saying, and I see that a lot. I don't think of it like a catch-22 because, you know, a lot of people tell themselves, you know, I would say like we're our own worst enemy, and we tell ourselves things, and we start believing stuff that we tell ourselves. So if I'm coming to you and being like, "Hey, what's going on?" and you push me away, talking about like, I don't want to talk and this and that, then for me, where I'm at, I'm like, okay, I came to you, I offered you a helping hand. And that same person will turn around and go and be like, "Oh, nobody care about me." Well, yeah, we do care about you. We came to you and asked you what was wrong. You chose not to talk and want to talk about it. And that's what I was saying earlier about realizing the truth in every situation. We got to realize a lot of times, like those type of people that we're talking about, like they're the cause of their own stress and depression. Don't because because a lot of people want it to be like served on a silver platter, like you're drowning but you waiting on, I'm coming around on a little paddle boat. You don't want to get on my paddle boat because you thinking a big cruise ship, luxury liner, dripping gold is going to come and rescue you. It's not going to be like that. So you just got to realize, a helping hand is a helping hand. And you know people don't realize they cause a lot of it is what they tell themselves. That's what caused a lot of their stress and drama. And as far as like to go back to what you were saying about being alone, for me, what worked for me, I used to like being alone because if I got too many people around me, I can't hear what God is trying to tell me.
Yes.
So it's like God had to push me away from everybody else and get me alone so I could hear him better. And that's what made me realize a lot of things.
I'm not gonna lie to you, I feel like some of our mental health too is God talking to us and we think we're going crazy. I feel like, because for me, I talk out loud. So if you walk past my patio and you see me on the patio and you don't see, there's no earbuds, you don't see no phone, no nothing, I really be having a conversation with God. So if you walk past, you're gonna think I'm crazy, but I'm not crazy, I'm talking to him, and that word crazy really triggers me on the cool. And it really triggers me because with having an uncle that they used to tease for, being called crazy Cliff, that used to trigger me. Like somebody like, "Oh, you crazy, girl. What you mean I'm crazy?" So that's a paranoia. So I know you said some people don't know how to express, they don't express and say how they feel. But if you never been taught to how to express yourself and somebody comes to you and asks you, how you feel, and if I can't explain it, how can I express myself to tell you how I feel? You get what I'm saying? Like sometimes I'll be like, I can't explain how I'm feeling. It's not that I'm trying to push you away. I just can't explain how I'm feeling right now. And that's me now being an adult learning how to communicate that. But younger me, I would shut down. I would like somebody, "What's going on?" Leave me alone. Just leave me alone right now. I don't know what I'm going through right now. So just leave me alone. But nobody told me how to express my feelings to be able to say, "Hey, right now I think I'm having an episode. So I'm about to pull away because I don't know how to handle this episode because it's a little bit stronger than it normally is. So I'm about to go MIA for a minute so I can have my manic episode, but I'll be back."
That's more why we need to keep having these conversations, and we definitely need to be talking to each other, and we need to be talking to the young people because, like you said, a lot of people don't know how to express themselves. A lot of people don't know how to ask questions either to see how somebody's doing. Like she was saying, you can ask somebody how they're doing and they'll say they're fine. But when you really start to try to dive in, because you sense that something is wrong and they don't want to tell you, but you got to be able to ask certain questions in a certain way. Now, if you're one of those people who, you come around and you're talking about other people and their business with that person, yeah, they're not going to trust you to tell you what's going on with them. But if you are a trustworthy person and they feel that you are genuinely caring about them because they know that you care about other people, then they're more willing to open up. So, we just need to make sure that we're vigilant and we keep having conversations and keep helping each other to be able to talk to other people about what's going on with them. That's the only way that we're going to be able to help people.
Yeah. And I know hers just fell out. She probably jumped back on. But Chelsea, because you are the youngest on this panel, I want to ask you, do you see the difference with your generation with getting help with mental health and the acknowledgement versus somebody from my generation? Do you feel like we're still in a place where we don't acknowledge our own mental health issues?
I definitely think it's completely different when it comes to mental health because it just wasn't talked about and it was this automatic, unspoken, like you just don't say anything, you just don't acknowledge it. So my generation, I feel like, is all around more generally accepting, not just of mental health, but you got the gays, the he's, the theys, the gays, all everything's just more accepted. And I think along with that comes like mental health, and it's just a bit different for this generation because so many people are dying, and those suicidal numbers are getting more and more and more. So I think people have just made it a point to go out of their way to make more awareness for it, to bring more appreciation for it, more fundraising for it to those causes, because so many people are losing people. And as much as I'm not in love with my generation, I think that's something to be admired.
I have to say, I do admire your generation. At first, I was one of those people that would say your generation was kind of lazy, but now that I'm a little bit older and more wise, I have learned so much from your generation to pull back, take those mental health days. Because like for me, Miss Ella, your generation was the push everything to the side generation, and I'm going to go, go for it. If I'm having a bad day, I'm going to go for it. So now that you look back and you're learning what you know now about mental health, do you look back and say, man, there was so many people around me that had mental health problems?
Yes, I do. Lots of people, but they were afraid to talk about it. And like I was saying earlier, they keep things bottled up inside until it snowballs and then you explode. But like Jamel was saying, you are receptive to sharing your thoughts and feelings with other people if you know that person is genuine and they have your best interest at heart.
Mm-hmm.
That is a given. And I'm more acceptable now through you, thanks, to talk about stuff and to open up. Because I'm not really trusting of a lot of people, and I don't deal with a lot of people. But the older I've gotten, as someone would say, what do I got to lose by not talking to anybody? Because it's not an age thing. I can learn from somebody that's 20 years younger than me, 30 years, or even older. Mm-hmm. We're in this together, and it's a problem in our community. And it needs to be talked about. We need more programs. We need more situations to where we can get out there, do stuff in the community, become an advocate for mental health. It has always been there. It's always been there.
We just didn't have the resources that we need.
Exactly.
But I do want to ask you, Philip, because I know you was part of the government officials. What was the Army, the Navy, the military? Which one?
Army.
The Army, part of the government. But I want to ask you, so when you leave, do they give y'all therapy after y'all leave? Because you're going different places. They're teaching you how to kill on the cool. Am I wrong? They teach y'all how to kill. So to teach somebody, right, that's taking like some of their, to me, what is it? Not morale, but I can't think of the word, but it's taking some of the goodness in you away, because if you have the ability to kill, then do they give y'all therapy after that? Do they push y'all through like, hey, I know you're gonna have PTSD, so here's the counseling? Like do they make it required?
It's not required, but it's there. For me personally, my whole thing was just, it's in the past, just leave it there in the past. I was like, I don't need counseling. I did my job. I did what I was supposed to do. I just looked at it as a job, and if it wasn't me, if it wasn't them, it was gonna be me, plain and simple. But the therapy is always there, because a lot of people can't. I mean, it's so different aspects of the military. It's more than what you see on TV. Especially like doing what I did, my job, I was like deep undercover stuff. So it's like, that stuff never gets shown or broadcasted, but just the stuff, just doing that, a lot of people, you'd be surprised, how many people just have the mindset for it. But if you don't, it could break somebody down real bad. And I've seen it happen like so many times. And, they come back, they need therapy, because, yeah, you think like, okay, I'm going to the military, I'm going to serve my country. But when you out there and you actually serving your country, it's a whole different story. It's not gun ho like you thought it was going to be, So yeah, the therapy is always there.
And I bring that up because y'all have to think about during those times where they had Vietnam War. They were recruiting out Black men like no other, and they were sending them back to the areas having PTSD because they did things that they didn't think they was gonna ever do. Now you go and you bring that trauma home. Now you passing trauma down to your family because now you snapping, you having nightmares, and you taking they're paying out on your family. Now you're causing, because I think mental illness can either be born with or developed. Now you're causing somebody to develop mental illness, that had nothing to do with it. Now it's being passed down and passed down. Do you think it should be a requirement that after you leave something like that, or even a job, that they should give you some type of required therapy after those things, so that way you don't feel like you're going to snap?
I think I don't think it should be required. I think everybody is different. Because some things I can handle mentally, you can't handle mentally. Some things you can handle mentally, I can't handle mentally. It just depends on the person, that individual person. I've seen them for certain people, because some people say they don't need it, but you can look and tell that they really do need it. And it's suggested. That's when they make you go. And it's not just the traumas for being out there. Like, I mean, because you gotta look at it in a whole list. You got people coming from, where we can move around freely here. You don't have to, watch it every step. Then you put them somewhere where you have to kill people, kids, older people and stuff like that. Then you bring them back here, and it's like, okay, you good? But no, they're not good. And that's when everything go wrong in their head, and they need the therapy and stuff like that. But the therapy is always available. I just don't think it should be mandatory. Let me take that back. I think it should be mandatory, because like I said, some people say that they don't need it, but they actually do need it. So I think it should be mandatory, just to make sure, like, all right, he's okay, or like, nah, we need to see him a little bit more, because he's saying he's okay, but he's really not. So I think it should. I changed that. I think it should be mandatory.
Do you think they purposely did that to create more mental illness in our community? Because as you know, mental illness has really caused us to divide. Because if I'm paranoid and I can't trust you, I'm not going to get with you to help create nothing. So do you think that was set up to help divide our community even more? Because again, you bring people in and you bring drugs in our community. Drugs make people go crazy too, and the real type of crazy. And then again, trauma causes mental illness. So do you think that has helped cause us to be divided, mental illness?
I think it plays a part. I don't think it was intentionally for that reason. I think it was more like I think it was like a different reason. But then when this came up, it was like, oh, we stumbled across something else. Now they mentally messed up. You know what I'm saying? I think it was for a different reason, but it just stumbled across the mental illness, and like, okay, now they mentally, because they always thought of us as animals, as savages and stuff like that. And, putting us in war, all right, they'll adapt and be cool. But, now with the mental illness, coming about, it's like, oh, okay. Because, it's like, it feels like we always been they always try to, take us out. And no matter what they do, we still here, a lot of people don't, they don't realize we came here with y'all. This ain't y'all country neither. Just like this ain't ours. It's the Indian. So, you can't get rid of us. So I think it's just something that they stumbled across in the midst of trying to do something else.
What you think, Kasim?
I'm torn. I'm saying yes on one end and possibly no on the other, because as an example, the drug usage, I feel like that's an option that they chose, as far as it affecting their mental illness. As far as you having, and I'm not of military, oh, and thank you for your service, but as far as going over there serving the country, now that is a necessity that one has to do. You don't have a choice. And then you learn all that behavior and then come back and then there's not anything implemented. He stated it is there and it's an option, but I kind of feel like maybe the options need to open up more. Maybe it shouldn't just be a yes or no and you're able to make that choice on your own. Maybe everybody who goes off into the military that comes back have a report on them or an eval on them or something more. It's just not enough to say, hey, you okay after killing up all these people or serving your country or whatever, and you say, hey, yeah, or no, and move forward. I just think it's so loosely handled that they should tighten up a little bit more.
Ms. Etta?
I agree with her. The military should tighten up more. I feel like it should be. I've never been in the military, but I feel like it should be a requirement. And a person should maybe be under observation. I'd say maybe for a year or two after serving. You know, because you don't know, the least little thing could make them trigger. And as Philip was saying, everybody's mindset is different. Some people can go serve their country, kill, handle it, come back and they're normal. And somebody else may come back and get to having flashbacks and snap and start hurting innocent people.
What about you, Chelsea? Chelsea? I think she on mute. But I know Katina had brought up something about drugs being a choice. I know drugs is kind of a choice, but if you think about it this way, I go to the doctor, I have surgery, they put me on pain pills. They don't teach me that these pain pills are addicting. So now I'm taking them for the pain, but it not only numbs the pain, it numbs the pain that I'm feeling deep down inside at the same time. And because this feel good feeling and I take that pain away for that time, I'm gonna keep going because I want that feeling all over again. And then you gotta think about, even when we go to some therapists, the therapist is seeing you to a psychologist, the first thing that they do is throw you on drugs. That is the first thing they do. So it's easy to say that it's a choice, but when they're pumping it in you, then you go keep looking for what, then they snatch it away from you. They don't give you no recourse.
Okay, but let me jump in, Carisha, real quick, as you use that as an example. Let me use myself right now. So I am currently in therapy, and yes, they have given me several medications. Now, I want to say this. Has anyone evaluated me mentally for any type of mental illness or anything before they gave me the drugs? No. Now, I'm blessed to not have to have a mental illness that I can make the choice to say, I'm not taking all of that. Or if it's bothering me or making me feel a certain type of way, or if it has me, hallucinating or something, I know to stop. So again, with the medical providers, the physicians, the therapists, everyone, they need to tighten up and stop giving out the drugs just because my eyes hurt, you want to give me a drug. I cut my finger, you want to give me a drug. I mean, I hold them accountable because they have no one gave me a piece of paper or set me in front of anybody to check my mental health. So I fought them.
I agree with that in the sense that because they keep you sick, that's how they make more money.
Yep.
So it's like a lot of the drugs that they give you, a lot of the drugs that they give you, the side effects is worse than what you actually have. So now you take a drug for your finger hurting, but the side effect is you bleeding from your ear. Now you got to take a drug because you bleed from your ear. The side effect is you got an arm growing out of your neck now.
And then you got suicidal thoughts. I'm gonna give you this antidepressant, depression, but you might have suicidal thoughts with the antidepressant. So might have suicidal thoughts, but this is the antidepressant. So I want to kill. I want the depression gone, but I want to kill myself now. How does that make sense? Or are you
Yeah.
increasing the depression so you can increase the drugs so I can keep buying this? So I think now we got to start coming up with a way. How do we heal each other? Because to me, that mental health is another disease that can help be healed. How do we heal each other going forward? We'll be able to seek the right help without them throwing drugs at us. What can we do as a community to help each other?
It's hard because the reason why it's hard because they give, a lot of people got titles, like they got the title of doctor. So when you start saying, like, oh, my doctor said, they're like, oh, well, a doctor said it, so it must be true. That's not always the case.
God.
Just
right.
because they hold the title of doctor, that don't mean that they're always right or always have your best interests at heart. So I think that's one thing we need to, that's where we need to start, because sometimes, you feel like, all right, I don't need this drug. I'm feeling good. But the doctor said that, but no, I don't need this. So it's just like, a lot of people jump because of people with titles, and they feel like, okay, they must not be lying because they hold this title. But no, sometimes they lie, and they only thinking about their own personal gain.
Mm-hmm.
Let me tell you, when I first got diagnosed with being all those alphabets, when I tell you that doctor was like, I'm going to try this, I felt like a guinea pig. We're going to see if this works. We're going to see if this works. We're going to see if this works. You don't know. Now you got me popping pills because I'm like, the way this feels. I'm like, wait a minute. I feel as a goose. I feel like a Bootsy song. I'm not the time I feel loose as a goose. Don't get me started, because it got me feeling loopy. I was not myself and I wasn't thinking straight. And then every time I come to you, it's like, oh, okay, I'm behaving this way. Okay, we're about to try this. I'm like, man, you just want me to come in here so you can really get my money. As soon as I said that, right, in the letter to the insurance company, say you don't want to see me no more because I told you about yourself. I said, oh, okay, you putting me on all these drugs and you keep having me come in here at least once a week to ask me how this pill making me feel. When you could really ask me on the phone. You ask me over the phone, you can't get a copay. But as long as I keep coming in person, you can get a copay. So now you want to do medicine management now. Well, it takes a couple of months. No, baby, don't prescribe me nothing that's man-made no more. Can you make it God-made? But I know you can't recreate God-made nothing. So now I seek somebody who can not only talk to me about what I'm going through, I make sure I tell them when I get a therapist, I do not want to be put on no pills. You're going to teach me how to manage my triggers. This is what I need you for. I have triggers that I have not fully healed from, and I need you to teach me how to move forward from it.
When you go to the doctor right now, just say you got to go for a reason today, they're not going to ask you that. They don't even check your medical history. We, the people, have to actually be mindful. I take my mom like 2 or 3 times a week. She has cancer. But I mean, we have stopped a lot of that because we figured it out too, Carisha. It's all money. They're giving her all these type of let's try drugs to get money. But they don't ask you adequate questions and go behind and check your medical records. I mean, at my age, and I'm sure you have everything since I was born here on file because I'm a native here, and you do not. I can tell you right now, Justin is an example. I can tell you right now today, I'm pregnant. They're going to say, okay, and move forward. They won't prescribe this because I said I'm pregnant, but they'll give me prenatal because I said they won't check anything. And it's sad because they are killing us.
Mm-hmm. And we feel like, I'm not saying we letting them. We have gotten so in a point because I love to bring up slavery. I know y'all probably get tired of it. Other people might get tired of it. But what has happened is we have become so reliant on the white man because the white man brought us over here through fear up in us to tell us this is what we're supposed to do and how we're supposed to move and how we're supposed to act, that anything that they say is right. But all they've ever did was try to bring us down. So it is passing down that trauma from trauma to trauma. And we think the doctors are right because they tell us that the doctors are supposed to be right because they go to the white man medical school. They don't learn about how our bodies are made. So when we have those mental breakdowns, like you said, we go to the doctor and tell them this, they don't ask no other questions. And then, okay, are you on antidepressants? I can lie and say no. I can lie to you and say, oh, okay, I'm on Xanax. Can I get another prescription since you're my new doctor? They'll give you that prescription without even thinking twice.
Exactly, they will.
without even thinking twice. Maybe you're not gonna look at my medical history. I tell you to draw my blood and I want you to run it for everything, but you don't run it for all the panels. And then you don't have the right panels for my melanin. Because I know, because my skin absorbs the sun in a better capacity than your skin, that there's certain elevations that my organs may have that yours don't. So you don't take into account for that. So you tell me I got liver disease or kidney disease or heart disease or whatever, and you tell me you tell me I'm okay because you basing it off of your race. But for my race, that's elevated. So how do we get the means to start? Because we be so wanting our kids to go to be doctors and nurses and stuff, and not realizing they still learning how the white man want it to be done. How do we start educating them on really our bodies when that's the basis of the education to even say you got the degree?
Well, personally, I think it starts for me in-house. But again, once child, as they grow, let's say they want to become a doctor and go into that field, the only thing we can do is pray, wish, hope, whatever you believe in, that they remember what I try to instill in them. But again, you get out there, you go to all these big prestigious schools, and you pick up things, that you feel is right or that they're telling you is right. I mean, so it's kind of it's kind of a hard rock type situation for me. I can only do what I can hear for them. But once they go to school, of course, hey, what does mom know? Mom's not a doctor. Mom didn't go to medical school. Mom, we're going to medical school. So it's just going to be their perception or in their belief as they grow, because mine are still young. But as far as their siblings or neighbors or other children, I guess you just educate them, those that you can, because nowadays people don't even want you talking to their kids. It's not like the village raised the kids anymore. You have to be very mindful, because some parents now don't want you, even if it's positive information, they don't want you trying to overstep them or seem like you're better than them. So, Corinne, it's kind of like I'm in the middle of it all right there. I'm stumped.
Yeah. Well, you guys, I am going to end this here. As always, I enjoy these conversations that we have on a Zoom. I hope that, people come and run across these posts that we post, and hopefully it starts to change the thinking in our community. That's really my goal, is to get us to start having conversations of uncomfortableness. Because if you start having those uncomfortable conversations, they eventually become comfortable. So this is just to start jumpstarting people to think, to have those conversations. We are going to have, of course, more of these more often too, and we're going to have various topics, because again, we're trying to cause healing in our community, because it's about time that we start working together and start building better for ourselves, because nobody else is going to help our community but us. So peace out, everybody, and I will see you guys next time.
I hit you up when I